Concerns over the coronavirus outbreak are growing. New cases continue to spread around the globe, and here at home, the illness has now killed 5 people in the United States. Officials are giving an update in King County, Washington. Let's listen in.
And we all feel responsible to our work colleagues, and we want to be a committed member of our work team. And some people, it may be very difficult to take time away from work, but we need to do all we can to protect each other at this time. In addition, as Dr. Duchin mentioned, if people want to further reduce their risk of COVID-19, they can consider avoiding crowded settings, particularly people who are older and people who have chronic health conditions. So we understand the concern that people are feeling about the situation here in Washington. All of us want to ensure ourselves and our loved ones are safe and protected. I want to expand a little bit around preparedness. Dr. Duchin talked about the need for us all to be prepared. Some simple things you can do now is make sure that you have food and basic supplies like medicine at home, like the same kinds of things that we would recommend that people keep in stock in case of other emergencies, like a power outage or an earthquake. Think about what you might need to do to make alternate plans for childcare. Talk to your employer about options for sick leave and telework. We have a lot of technology now, and now's the time to be able to take advantage of some of that technology if your work allows it. As the situation continues, local health authorities may make recommendations to cancel community events or close schools, but individuals still need to make personal decisions. We're committed to sharing really accurate, timely information, as I said, so continue to watch the Department of Health website for more information about testing results. And I'll also just reiterate that it's important to remember that most people with COVID-19 have mild illness, but as we are now acutely aware, a small portion will have very severe illness, and that is why we are working so hard to try to decrease the spread of this virus here in Washington. And with that, I'm going to introduce Dr. Palazzo.
Thank you, Dr. Lofi. I am Tori Palazzo, the Chief Medical and Quality Officer at Evergreen Health in Kirkland. A lot has happened in the last 72 hours since we learned of our first positive case of COVID-19. Before going any further, I first want to simply say that the organization is extremely grateful for the outreach and support that we have received from not just the local communities, but across the nation. And it is quite humbling for myself and the entire staff at Evergreen Health to receive that support. I also want to thank the Washington State Department of Health, our colleagues here at King County, Seattle Public Health for all the support, and of course the CDC as they help us and guide us on this journey. We started our testing protocol and identification of COVID-19 last week following the CDC guideline changes at that time. When we were alerted of our cases, we went ahead and followed those recommendations, and those patients went into appropriate precautions and appropriate monitoring, and all care providers working with them following the appropriate precautions as well. We now, at this time, have 10 confirmed cases of COVID-19 at Evergreen. Despite our best efforts, 6 of those cases have died. And our condolences go out to the patients' families in this time.
Sorry, you said 6.
I did, and so I'll note that one of our patients is a Snohomish County resident as well. So we have, as I understand it, and my colleagues will help correct me if I'm incorrect, this is the data that we have, that 5 of our cases that had died are King County residents. We do have one that is a Snohomish County resident.
There's 6 deaths in all in the state. Is that correct?
As of this morning at Evergreen Health, we have 6 deaths with positive coronavirus.
Maybe after Dr. Palazzo is finished, Dr. Lofi can clarify the state numbers.
Please.
Very good. So at this time, along with our current confirmed cases, we have approximately 29 cases that are pending investigation total, and we are waiting for those results, and those patients are in appropriate precautions, and staff caring for those patients are following all the appropriate CDC precautions there. We have made adjustments at the organization to allow for airborne precautions. We are in a situation where we're able to convert our entire critical care unit over to a negative pressure scenario so we can keep those patients and staff caring for the patients safe, and we have those capabilities in other areas of the hospital as well. At this time, our staff are making adjustments to care for the patients, and that is going as well as can be expected at this time. Again, I want to thank the support of the community, thank all of the staff at Evergreen Health for their work, and everyone that's working to get us through this time. I'll go ahead and hand over to...
Let's have Kathy come back up and...
Sure.
Yeah, so 6 should be the correct number. We were at the department aware of the 5 deaths from King County. We had not received the report about the Snohomish County patient just yet, so everything gets kind of reported up the chain. So, yep, apologize for that.
And all those deaths have been at Evergreen? Is that correct?
We have had 6 deaths at Evergreen.
How many of them come from that, the Life Care Center? Those.
So do you want to have Jen?
Yeah. I think at this point I'll go ahead and hand off to Dr. Duchin. He can continue discussion.
Thank you. I want to emphasize one point here, and you know, our colleagues at Evergreen have been very aggressive about testing seriously ill people with unexplained pneumonia, which is a new criteria for testing. And we're now identifying patients that weren't able to have been tested before. So I don't want you to get the impression that, you know, there's these cases are necessarily occurring right now. They're being tested right now. So they have probably been occurring for a while. And as you know, we haven't had the ability to test for mild cases until this week, basically, with this new lab capacity that's coming online at the University of Washington. So you should understand that there are likely many mild cases in the community that we're not aware of. The cases that our healthcare system colleagues, like Evergreen Health, are finding are those tip of the iceberg patients that are hospitalized with severe illness. So it's important to understand that the vast majority of these cases that are mild are going undetected. But the other thing I think is important to understand is that what you just heard illustrates the challenge of this disease. This is like a severe influenza. It drives many people into hospitals. It causes many of us to feel sick and stay home, many more than go to hospitals. But as you can imagine, the public health system and the clinical healthcare delivery system do not have the capacity to track down every case of influenza in the community. And we're going to be probably, my guess, seeing more cases of coronavirus than we see of influenza over the coming weeks to months. So at some point, we're going to be shifting our approach from counting every case to focusing on outbreaks, perhaps cases that occur in hospitals, and we won't be able to do the kind of individual case follow-up and case management that we're doing early on during this so-called containment phase of the epidemic. And we are still trying to contain to the greatest extent possible. But at the same time, we're pivoting towards a more community-based approach, very similar to what we use for influenza epidemics, where we give people and schools and businesses good advice on how to protect themselves, how to minimize illness in their students, staff, how to minimize risk at work. And we understand that people still need to carry on with their lives, just like we do during influenza season. So we give people good advice on how they can reduce their risk, how they can manage if they do get sick. But it will be very important for everyone to understand that we're going to see a lot of sick people, and we're going to have a tremendous challenge on our healthcare system, and we're not going to be continuing to try and focus on every case, and that case is contacts. We'll give people good advice on what to do when they're sick, how to prevent illness from spreading, but again, it's not going to be that individual case follow-up. just I wanted you to understand that's where we're headed. Dow, did you want to make additional comments?
No, I'm just going to ask for questions. So, Jeff, stay close. We're going to open it for questions. I just want to make note of a couple things. I wanted to thank Councilmember Reagan Dunn for being here in support today. I've received your strong messages of support and solidarity in our efforts, and I appreciate it. I also received a call from Senator Patty Murray this morning expressing her support, seeking information about how she can further help, and she is busy fighting to ensure that federal funding includes funding for local agencies and this local response, as well as that money directed by the federal government is able to go to hotspots around the country. She's very much in tune with this and very personally engaged, as she's from communities nearby here originally and has family members across many of the areas affected. I'm going to ask if you have questions to direct them to the right person here, and then we're going to have some follow-up about the items I talked about, additional capacity for people to be isolated, et cetera. James?
Yes. Before we go to questions, we're now going to hand out the release and the individual, with the list of the individual cases, so we can answer your questions around that.
Dr. Nugent, is there a commonality here in terms of underlying conditions? I understand you have privacy concerns, but we now have a number of deaths. Can you talk about the kinds of underlying conditions that folks are seeing?
Well, in general terms, I can. I mean, again, this is a very small number of people we're dealing with, 14, so it's hard to generalize, but I can say that, people who have chronic lung disease, chronic cardiac disease, diabetes, the same types of chronic conditions to a great extent that we worry about with influenza seem to be at increased risk for this disease. Now, again, this disease wasn't even known to us 2 months ago. So we're still learning a lot about specific risk factors for disease, spectrum of disease, how severe it really is, how many people get seriously ill, how many have mild illness. So it's apparent from what's been reported from China and from what we're seeing here locally that the patients who are having serious illness are those who are either very old with weakened immune systems due to age or have underlying chronic diseases. But there's too few patients to say specifically whether one underlying condition is more of a risk factor than another at this point.
Can you say whether we have capacity with our ICUs in the area to handle an influx of lots of very sick patients? Are we going to bring in more equipment, ventilators?
Yes, so excellent question. This disease will pose a significant challenge to the healthcare delivery system across the country and across the world. And our healthcare delivery system is rather well coordinated. We have the Northwest Healthcare Response Network, which helps our system with resource allocation, sharing of resources, prioritization of resources during surge times. And we've done a significant amount of planning with them, so they are prepared to make available as many beds and intensive care beds as they can. They've been thinking forward about this since the outbreak occurred. So it's impossible for me to predict, what the peak of this outbreak will be. And everything we're doing now is trying to blunt that peak and push it down by giving people advice on how to protect themselves from becoming ill and not running into the hospital if they're not seriously ill, to preserve those limited resources for those who really need them. But I can tell you that even this early in the outbreak, our hospitals are feeling the strain. And I would refer you either to Dr. Plazzo, who may want to comment about Evergreen, or Dr. Balaga, who can talk about his experience at Virginia Mason, or you can reach out to the network, to hear some of what they're experiencing.
Do we have capacity, though?
We have capacity. The question, what we don't know is what the supply and demand is going to be ultimately.
Would you mind giving the ages and information on the success?
I'm sorry, I don't. What's the question?
Information on the people who have died. Could you repeat that one more time?
Okay. I have. James, the handout has information on.
The handout doesn't have information on. There's another handout going around that has all of the information about the cases.
It's missing some dates of death, and we wanted to ask if the folks who have died. How many are linked exactly to the life care facility?
Mm-hmm. Yeah. So as you know, we have an outbreak at the long-term care facility, Life Care in Kirkland, and I just wanted acknowledge the incredible work that organization and their frontline healthcare workers are doing to both keep those residents safe, but also keep their healthcare workers safe. We've had staff on the ground with them. We have our CDC colleagues working with them to make sure they've got the best infection control guidance and are taking all the recommendations that we can possibly provide to keep their staff and their patients healthy. And we really appreciate, their dedication. They're working very hard and very long hours, and we know it's stressful for them. So of the 14 cases that we're reporting, 8 have been linked to Life Care. And of the 5 deaths that we've reported, 4 have been linked to Life Care.
And the other 2, do we know the sources or links of?
There's one additional death that was unrelated to Life Care.
Executive Constantine mentioned modular housing for homeless populations.
Mm-hmm.
Is there a stage 2 plan for if more individuals who are homeless become infected? What happens after those 100 or so?
Yeah, clearly we're very concerned about, many of us can shelter in place. We can go home. We can even work remotely. That is not an option for people who are unhoused. The challenge is making sure that people who become infected aren't in shelter and causing infection to others, and that they have a safe place to be in isolation or quarantine or recovery. We are standing up capacity, which we believe will be sufficient in the short term, but we're going to continue to push to create capacity because, one, we want to make sure those who don't have housing have an appropriate place to be. And 2, we want to make sure that hospital capacity is not being taken for people who need only to be in isolation or to be in recovery. We need the hospital capacity for people who need treatment now. And so our facilities division is working very hard to site as many appropriate units as possible, and we're going to continue to push that real estate effort.
Executive Constantine, when it comes to those homeless camps, there were outbreaks of things like hepatitis that was reported in April. We have different people with the flu and things like that. Why is there now a sudden concern for the population when it comes to the coronavirus?
Each of those epidemics or those outbreaks is obviously a concern. The coronavirus is, novel by name. It's different. We don't know the shape of it yet, the way in which it spreads, or the seriousness in terms of who will be affected and how badly they will be affected. So our public health folks can talk about the similarities and the differences between those different diseases, but I think that we are all recognizing that in the case of a global pandemic where very little is known, where no one has natural immunity, where there is no immunization and there's no specific known treatment, we need to take it most seriously and to take extraordinary measures, including moving resources quickly from other areas in order to provide the ability to isolate people and give them the opportunity to recover without infecting others.
Dr. Nugent, there's a question about testing. You brought up testing a couple of times,
sure,
and how that changed with the CDC mandate. So,
not mandate. They produce guidelines that we follow.
Guidelines. Yeah. What changed in King County? I mean, are we talking about now? Put it in layman's terms. Are we talking about now that the numbers are going up because the testing is better? What happened prior to that?
Right. So there's a couple of. So let me give you the history on the testing situation. When testing first became available, it was limited. And it still is limited to some degree. And because of that, we had to prioritize who we could test with our limited resources. So we were, the guidance was, and we followed, to test patients who had the most serious illnesses, the hospitalized patients, because we thought it was, and we still think, it's most important to identify patients who are critically ill and don't have another explanation, and those who have a risk factor for having novel coronavirus disease, so someone who had a link to a known case or a travel to an area where an outbreak was occurring. But as more testing capacity becomes available, we can test more people who are, and that means people who are not critically ill. So people who might be in the community who aren't sick enough to require hospitalization. And as we begin to test, so we had this surge in patients recognized last week, as we started to test, we found out that this virus has been in our community, obviously, and it's made people sick, and we are now recognizing that because we're looking for it. And the more we look for it, the more we're going to find it, and we're mostly going to find it when we have the ability in people who are not very sick and people who have mild flu-like illnesses. And so as the University of Washington and as commercial laboratories start making this test more widely available, we'll see it being used just the way we see influenza testing being used. That someone goes into the doctor with a cough or a cold, gets tested on the premises, doesn't need to be admitted to a hospital like you did initially for this COVID-19 disease, and can get a result. And this disease will need to be managed much like we manage seasonal influenza. Many people will have it. Most people will not be seriously ill, but we want to do two things. We want to protect those who are most at risk for becoming seriously ill, and we want to prevent many people, as many as we can, from becoming sick at the same time. So these social distancing measures, keeping people as far apart as is practical, acknowledging that we still have to go on with our lives and our community, but to the extent that we can limit our interactions, we will be decreasing our risk of getting sick and decreasing the number of people that need to see healthcare providers and enter our hospitals until this epidemic passes. So as we test more, we will see more. Some of that is due to cases that were already here but not recognized, and some of that will be due to new transmissions that are occurring in the future.
So what are you looking for that will make you say, now is the time that we're going to cancel public events? What sort of level of cases over what period?
Yeah, that is an area of active discussion nationally now, the so-called triggers for doing the community mitigation guidance. We certainly are beginning to think very hard about that this week, because we have these recognized cases in the healthcare facilities, and we believe that there are cases in the community. So we're going to be looking at our measures. We'll be looking for the extent of community transmission, the evidence that we have for the extent of community transmission, not, for example, focused on one facility, but in multiple spaces, multiple locations in the community. And then a key issue, again, is severity of disease. Right now, people may be getting the impression this is a disease that makes everybody seriously ill. That's just the opposite of what it actually does. It makes most people mildly ill, moderately perhaps, and just the tip of the iceberg, but the ones that we happen to be looking for currently are seriously ill. So we want to get a good sense of how severe this illness is, and particularly we'd like to learn as much as we can about the role of young people in either spreading this infection or getting sick themselves, so we can think about the school issue, school closures and dismissals. As you know, a lot of the community mitigation guidance is disruptive. I mean, we should be prepared for disruption in the community if we tell people not to go to work, not to go to school. And so we have to really carefully weigh the risks and benefits. There are so many unknowns in this outbreak right now. We don't know exactly when's the right time to implement. We don't know exactly how long do we need to keep schools closed or tell people they can't go to work. The idea is to lessen the impact. We know we can't prevent the outbreak. So as we get more information from our colleagues in the healthcare system about the number of ill people coming in, the severity of illness, work with our CDC colleagues and some of our epidemic modelers about the appropriate timing, we'll be making decisions. And I think you can expect over the next 2 weeks probably to hear more from us about community mitigation measures and what we might think are the right time to do it. As I said, we can't expect people to go for months and months, without school and without being able to go to work or telecommute necessarily. So we want to make sure that what we do is reasonable, that it's something that's acceptable to the public, that they feel like it's worth it to keep our community healthy, and that the timing and the duration are right. And all of this in the face of tremendous uncertainty about the benefits of doing anything at a specific time or a specific duration. So we're going to be making judgments based on the values of our community and our leadership, and knowing that the benefit and the risks are all really not clear at this point.
Okay, so We need to get Dr. Duchin and our responders back as soon as possible to their work. We'll take 3 more questions. So,
can somebody speak to, there's a lot of parents out there that are pushing for school closures who are worried. Can someone say something to them?
Thank you.
So we are indeed getting a lot of calls from both schools and from parents.
We have been listening to officials in King County, Washington, giving reporters an update on the coronavirus there in Washington state. They tell reporters there have been 6 deaths in the state, and there are 10 current cases at Evergreen Hospital. Officials said, as has been reported elsewhere, that it appears elderly patients, as well as those with underlying risk factors, seem to be the most vulnerable to catching a severe case of COVID-19. Several of the deaths and infections can be traced to an outbreak at a nursing facility there in Washington state.